And in this webinar, we want to talk about different conditions we see in the clinic and how over time you can improve on your health going forward. I'm Dr. Cary Yurkiw, and I have over 30 years of experience working with patients here in the clinic, 31 years, and we do chiropractic care here. We offer other services like shockwave and laser in the clinic. We do orthotics and health coaching. We also offer health coaching through a consulting company for people who cannot come here to the clinic in Kelowna. I'm the founder of Tut Street Family Chiropractic in Kelowna and True North Coaching. And I'm very excited that you can join us today and just see exactly what we do. I'm the author of Why Your Body Hurts, Metabolic Reboot, and the 100-Day Diet. All of these books are on Amazon, and you can go to the link at the end of the webinar to see the different books we've written. So I want to validate the pain experience. Most women in 35 to 55 are told their pain is just normal aging or part of the aging process. Or sometimes it's attributed to stress, whether it's physical stress or strain, emotional stress, and that's just building up in the body. The imaging looks fine. You get some x-rays taken. There's some mild degenerative changes on the x-rays, but other than that, there's nothing pathological going on. But the pain keeps building. The real causes are almost never identified or addressed. So really, what we need to do is get down to the root cause of your pain. Now, why are women's bodies different? Well, there's an estrogen decline from the mid-30s, which weakens ligaments and destabilizes joints. There's chronic stress that starts to develop around that age group and can persist, which physically reshapes your posture more into a defensive posture and compresses joints over time. The caregiver load, years of lifting, bending, putting everyone else first, children, aging parents, spouse. So there's a lot of demands also that are put on your body. The 5 real causes are pelvic misalignments and SI joint dysfunction, the most misdiagnosed pain that we see in women, a kinetic chain breakdown, how flat arches travel all the way up the back. So you have a flat arch, it changes the alignment to the knees, the hips, and the spine. And psoas tightness, glute inhibition, and systemic inflammation that amplifies everything. The proven treatment approach, we use chiropractic care here in the clinic, shockwave and laser, which allows you to improve your structure, so structural correction, and the soft tissues heal around that improved structural alignment. Custom orthotics, like correcting the kinetic chain from the ground up. If you have better foot posture, everything else is going to be in better alignment because of it. And then health coaching, the lifestyle layer that makes everything else stick. So just teaching you about proper stretches and exercises, teaching you about lifestyle changes like a proper diet, ways to cope with stress, getting enough sleep, hydration, all very important. For the 8-week reset, weeks 1 and 2, we want to work on pain relief here in the clinic, reducing inflammation, restoring joint mobility. Weeks 3 and 4, postural correction, address structural patterns driving the pain. And then weeks 5 to 8, lifestyle integration, nutrition, movement, sleep, and health coaching. So I think this is where our clinic is a little bit different, maybe than other clinics, in that we have a very structured approach to correcting the problem. Here's some real results. You can see these in our reviews online. Chloe said her pain went from 8 to 4 out of 10, and she's moving towards pain-free just after a couple weeks of care. Jody, fibromyalgia and arthritis pain was relieved, range of motion restored in weeks. And Ellie, desk worker with visible postural hump, felt 10 feet taller after care. Now for a call to action, I'm going to encourage you to join our mastermind group where we're going to dive deeper into this topic in the coming weeks. We'll be doing this on once a week on the lunch hours, the same day and time as this webinar, and you can join us and learn more about what you need to do to help yourself to improve your health. We'll also offer you some one-on-one coaching that's going to be a little bit more personalized for you. And I would encourage you to take advantage of this because there's limited spots available for these programs. If you're interested in coming to our clinic, then go to our website, tutstreetfamilychiropractic.com, and you can book an appointment there. You can always call our clinic too, here in Kelowna, to book an initial appointment. I want to thank you for joining me today. I hope you enjoyed this webinar. I hope to see you in the clinic, at our mastermind group in the next month, or through some one-on-one coaching in the future.